and thank you for joining us for the 2024 North Carolina Medical Society Candidate Series. We have invited all of our members who are running for state or federal office to join us and talk about issues important to the people of North Carolina when it comes to health care. And today we have our first candidate. This is Dr. Ann Contogiannis. I got that right, I think.
You did.
Yes, thank you for being here. Now, you're running for the U.S. Congress representing the 6th Congressional District.
Yes,
correct?
Yes, I am.
Good. So tell me let's kick this off with why you're running. Tell me what's motivating your candidacy.
You know, for me, the issues are, I am a physician. I'm extremely concerned about a lot of things in medicine because I want to take care of my patients, the people in North Carolina. So there are ways that I can work in Congress in conjunction with the state legislature and the medical society to provide better care overall for patients. I'm also very concerned about the direction our country is going in. I think there are issues there relating to, for instance, issues of border control, our national security, our personal freedoms, parental rights. There are so many issues that we can work to correct. And I want to be part of that team helping with that.
Well, for the people here in North Carolina, we've got some questions for you, and I want to get right into it. The first one, of course, is about North Carolina, and we have a sizable rural population, and there are some gaps in healthcare, as I'm sure you know. How do you plan, or what are your thoughts about correcting or helping the workforce shortage across the state?
Randy, I agree with you. We really need to work on taking care of everybody in North Carolina. That should be our goal, not just part of the population, the entire population. As I look at the workforce shortage, I see a few issues. One, we need to train more physicians to be part of that workforce. So we need to work on increasing our residency funding, and it's joint between the hospital training centers and the federal government. Unfortunately, a study was done that showed that by 2035, that there will be a glut of physicians, and instead we're seeing a shortage both in primary care and specialty. So at the federal level, we can work to increase that funding to get that done. On a state level, we need to also, in conjunction between the state and the federal level, we can look at providing loan forgiveness programs for physicians as they finish their residency programs to go out to underserved communities so that part of their student debt, medical school as well as residency debt, is forgiven with their term of service that they do. And lastly, there's the issue of physician burnout. And that is something that is beginning to be addressed. Our medical boards, our other privileging agencies are looking at how can physicians feel comfortable getting the wellness and mental health programs that they need without being stigmatized when they apply for privileges or take care of their patients. We saw a huge number of physicians resign with COVID because of all the pressures that they dealt with. And we're looking at turning that around, and that's a component of it as well.
And that helps get these physicians into the areas they're most needed, where these patients are looking for and needing help.
Absolutely. If we lose any one of those physicians, we've lost one too many. And we need to expand that number and get more people out there. One last thing that we can look at perhaps is more telehealth services. Mm-hmm. It's really difficult to take on a new patient, but once you have a patient and they may live in more remote areas, then you can provide better telehealth programs to them. And we saw that with COVID that we could do that.
All right, let's move on to this next question. We live in North Carolina where there are a lot of elderly residents, and of course, they've got some apprehension about Medicare. I know something that you are personally very involved in, and you have a lot of opinions on how to fix this and how to make things better. Tell me what you would do to calm the apprehension of your patients here in North Carolina when it comes to Medicare.
One of the biggest problems with Medicare is it just hasn't been updated since the 1990s. And because of that, as physicians, we're small business people. It's very difficult when there aren't inflationary changes in our payment model to allow us to take care of all the patients because we're a small business, so we have certain expenses. So we want to be able to take care of everyone in North Carolina. And this will allow us to do that by updating the whole physician Medicare payment model.
All right, perfect. Let's go to this next question because we're going to talk about contemporary healthcare now. Prior authorization, I know it's a hot button issue for a lot of physicians. As a physician, what do you think the issue and what steps do you think we could take quickly to help North Carolina when it comes to prior auth?
Prior authorization is a huge obstacle to me as a physician taking care of my patient in North Carolina. And so what we need to look at is streamlining that process. We need to get qualified people so that when we contact the insurance company, they can make a better informed decision and not create that obstacle for people to get care.
And to speed up things for your patients.
Oh, absolutely. That is the whole goal of prior authorization with that. And those are issues that are being addressed both on a federal as well as we can work with the state on that, because state control programs can be controlled by the state. So it will be a joint effort between federal and state legislatures.
All right, last question. I want to look ahead a little bit because there's a lot of things happening in the healthcare space right now. You talked about telehealth. Of course, we're facing an opioid crisis here in North Carolina. There are things like AI, which I think we're all just learning about and how to use. I know there's no crystal ball, but looking forward, what are the things that are important to you? What are the issues that you think are going to be important to the people of North Carolina?
A lot of the issues we talked about when we look at removing obstacles to providing patient care, prior authorization, dealing with the workforce shortage, dealing with updating Medicare for our seniors. We must guarantee that for our population in North Carolina. All of that together, telehealth that we talked about shortly, expanding the telehealth. I'm not sure on AI yet. There are lots of programs out there, but I'm certainly going to evaluate them from my practice. But it'll be a combination of things where we can lead that healthcare team along with providers who are properly trained to take care of all the people in North Carolina, because that's what we want. We want the best health possible for all our patients.
All right. Thank you so much for talking to me today. I love the answers that you gave. Just so I get this right, they can find out more about you and your campaign at Dr. Mary Ann for Congress?
Yes.com.
.com.
Yeah.
drmaryannforcongress.com. Thank you so much for talking to us.
Thank you, Randy.
You're welcome. And make sure you check back with the North Carolina Medical Society for more candidates from our membership. Thanks for joining us.